People should know that.
Asthma clinic at Manipal Hospital, Goa. Asthma is a condition that causes inflammation and narrowing of the airways, making breathing difficult, and severe asthma can cause trouble speaking and sometimes interferes with the daily activities of an individual. With the prevalence of asthma across all age groups in the state, it's an initiative of Manipal Hospital, Goa to provide an advanced care facility that is dedicated to helping patients breathe easy and thus give a better life. As we embark on this initiative of providing advanced care to asthma patients, let us recollect our vision to be the most preferred and respected healthcare organization in every location that we operate, and strive to provide patient-centric and ethical care to our patients. With this thought in mind, let us invoke the blessings of the Almighty and the wisdom of the Divine by kindling the traditional lamp. I would like to request our hospital director, Mr. Surendra Prasad, to escort our chief guest for today, Dr. Uday Kapotkar, HOD of Pulmonary Medicine, GMC, up on the dais. I would like to request our medical superintendent, Dr. Aditya Basavi, to escort Dr. Prashant Agarwal, Medical Affairs, West India, AstraZeneca. I would like to request Mr. Hari Prasad, Head of Department of Marketing, to escort our senior consultants present here, Dr. Prabhu Prasad, Department of Pulmonary Medicine, Dr. Shekhar Salkar, HOD, Surgical Oncology, and Dr. Deepak Murthy, Department of ENT, Dr. Pradeep Paidungat, Department of Internal Medicine. Up on the dais.
Close your, sir. Close your.
Thank you.
Very good morning and a warm welcome to all of you. It's a beautiful moment that we are venturing into a beautiful initiative today on severe asthma. So I'd like to elaborate a few details on the severe asthma and the clinic and the project we are going to program, we are going to initiate on a regular basis in our hospital setup. So this May being Asthma and Allergy Awareness Month, so asthma is a very common respiratory disease, which is complex disease and heterogeneous disease, and So in that asthma, this severe asthma is a subset of asthma, which actually, according to this year's theme of World Asthma Day, which was celebrated on 3rd of May. So they have highlighted that the closing the gaps and the care of asthma. So this fits into that gap of asthma care or asthma management in the public as a whole. So to discuss on this, I would like to present it as a major unmet need of the present day. So we know that the asthma is a very common presentation in any of the public entity and hospitals. But the point is all asthma same as a whole end? So not all asthma is same as we thought, because each individual patient, each individual asthma behaves in a different way. Biologically it is different. So in that subset comes this severe asthma. Severe asthma is a subset of asthma that remains uncontrolled despite the treatable factors has been removed. That means if the patient who's on asthma on higher level of treatment, like what we commonly use for treatment of asthma, that is inhaler, steroid-based inhaler treatment, if he's on higher level, but still he's experiencing a problem and difficulty in breathing, not control his asthma, then we need to think of this subset of severe asthma, because then that is the point where we should think as not as a traditional approach, as an advanced approach, that we need to differentiate what biological problems or pathways is happening in that patients. So to elaborate on this, as I said, the severe asthma is that remains uncontrolled. That means the patient will experience persistent symptoms and frequent serious attacks, despite the treatable factors has been addressed. Treatable factors here, I mean that the patient's the acceptance of treatment, that is the inhaler therapy, the adherence to the treatment, the inhaler technique, if that has been corrected, and if the patient still put on higher dose of inhaler therapy, if he still feels not good, not controlled on asthma, then we think of this condition called severe asthma. So why we have to bother on this subset of asthma? So as an international estimates, it's been seen that 24% of whole asthma patient will have on higher level of high intensity, high inhaled dosage steroid inhaler therapy, and about 17% of these patients are found to have a difficult to treat asthma. So among this 17%, only 3%, 3 to 10% of these patients fit into this severe asthma. But the percentage is very small, but still why we are worried. The reason being, this severe asthma entity causes a huge burden on the patient as a whole, as an individual, and it creates an emotional and psychological burden on the individual, on the healthcare cost will go up, and the hospitalization because of this disease severity goes up, and mortality also goes up, and his quality of life will be impaired because he cannot do his regular activity, regular job, he cannot do all this thing. That is why we are worried. These kind of patients will experience frequent severe asthma attacks, and they come to the hospital or emergency, and they need in the ICU care or hospitalization. That is the reason we are worried about this severe asthma. So how to diagnose this severe asthma? So first and foremost thing in this severe asthma diagnosis is, first of all, you should see whether that asthma patient is being labeled as asthma is real an asthma or not. Because all the set of patients who are on higher treatment level, many, more than 50% of patients will not experience the symptoms because of asthma, actually because of non-asthmatic problems which is experiencing. So we need to see whether the patient is really having asthma by taking a proper medical history, by taking a questionnaires, by doing a physical examination assessment, and by a lung function test and other comorbidity assessment. After that, we see how much this asthma is severe. So this kind of systematic and multidimensional assessment is needed to find out the correct diagnosis of asthma or asthma confirmation, and assessing alternative diagnosis if at all not asthma, and then teaching is self-management and triggers and identifying the managing of comorbidities, and then thinking what level of biological things is going on in his body for this asthma that is not to be controlled, and then you need to target that pathway. That is what the science has become, from a generalized approach to a personalized, stratified medicine asthma in these days. So these three domains of area which we need to consider in this case of patient, that is airway domains, comorbidity domains, and risk factor domains. Airway domains means to confirm the airway pathology, what is happening, really it is an asthma, how much severe, how much, what is the pathway it is going on, and to address risk factor which is contributing to asthma, and to address the comorbidities, whether the patient is having obesity, whether he is having additional heart problem which is mimicking like asthma, or whether he has a sleep apnea problem which also has a mimicking of asthma. All these thing assessment has to be done, and then those factors has to be removed before you label it as a 3% to 10% of asthma, severe asthma patient, and then you target those condition for this thing. This approach is called phenotyping of asthma, and then you know the phenotyping actually it's a very targeted approach where we do certain type of markers, biomarkers we call. Either it could be a blood biomarkers in the form of levels of IgE, in the form of eosinophils levels. We have heard a lot of our patients coming with high eosinophils, but really those eosinophilic pathways causing the problem in asthma, or how much level of eosinophils are they running in his body, and what can be. So that's the phenotyping, and then once we do the phenotyping, we can address and directly target that, and then the patients can be managed accordingly. So these are the commonly noted phenotypics of asthma. From asthma now, as I said, has moved from a single diagnosis of asthma into whether he has an allergic level of asthma, whether he has a eosinophilic level of asthma, whether he has a non-eosinophilic level of asthma, or whether he is a neutrophilic asthma. All those things has to be taken care, and then we need to address with a certain targeted treatment as elaborated. I'm not going in detail because each pathway of asthma is having a different molecule injection based, or medication based, or procedure based approach in that asthma. So as I mentioned, one treatment does not fit all in these kind of patients. We need to personalize this. We need to go in depth, go into the biology of the patient, and then isolate the each biology, and then along with your regular inhaler treatment therapy, you focus on adding a newer targeted treatment. Either it could be injectable biologics which are from these days, or it could be medication, or it could be a newer bronchoscopic procedure which I am going to enlighten in a few, one or two slides in the coming talk. So as I mentioned, predominantly asthma is a steroid based treatment. You know, we put a lot of steroids on patients, and patients of this, especially particularly severe asthma patient, will be having a higher dose of steroids, either tablet wise, yearly 2 to 3 times, 4 times receiving, but not affected. But really, these kind of oral steroids are not good, and they have their own adverse effects. We need to have a steward strip, and we need to find a solution, and then target and try to reduce the steroid treatment, and try to put on the non-steroid approach and reduce those. So that is where our innovative severe asthma clinic, what we are thinking. So most of the time in this particular center, where we in a specialized centers, we will be converging most of the reference to this, and organize, and the approach we will be targeting on different domains, that is multidimensional and multidisciplinary here all. So a lot of other departments will be involved, ENT or surgical, to tackle the issues, cardiac, everything will be tackled. Once those factors have been removed from the asthma patients, then you isolate this is a purely asthma patient, and then that purely asthma patient is having a severe asthma, and he is having a different pathway of whether allergic or eosinophilic or any other. So this is the proposed planning pathway we are thinking on this severe asthma clinic center we are going to run on weekly twice basis. So basically we will be having a clinical questionnaires particular to this severe asthma, and then we will be confirming the asthma diagnosis, addressing the comorbidities, addressing the risk factors, and doing the phenotyping, that is doing the biomarkers and doing the blood test and allergy skin prick test to see allergy pathway. All those things is done, and then we are going to treat accordingly with the targeted therapy, either with the biological injections or with the other things. So the main focus of service area in this severe asthma clinic will be to see the non-inhaler therapy approach along with the inhalers to be continued till the patient is on controlled asthma, to initiate the biologics therapy, that is a injectable monoclonal antibody therapies which have come these days. Each patient, allergic patient or eosinophilic patient, non-allergic patient, and giving the allergen immunotherapy because certain patients of allergic will have a troublesome allergies, and if you target that immunology of that allergy, whether dust allergy or dust mite allergy or food allergy, so then his asthma or allergy things is going to be controlled. And another newly proposed, stated procedure which has come into the practice is a bronchial thermoplasty, which I'm going to enlighten in the future slides. So these are the common biologic injections therapies which are approved in India, has been used for last 10 years. The first one to start was omalizumab, which is called monoclonal antibody targeting the allergic pattern of asthma, and the second one is mepolizumab, which was done, and the third, which is available and approved in biologics in India, is pantalizumab in the name of Pasendra. And these actually have revolutionized the asthma treatment in certain group of patients, in certain selected patients, in a different, and it is being given on a weekly basis or monthly basis according to two different pathways. So as I mentioned, there is another procedure which is bronchial thermoplasty. This is a non-pharmacological therapy. That means it's a non-medication or non-procedural type of therapy, which is FDA approved and also recently got IRDA approved. And the basic idea in this is, certain type of asthma patients will have a characteristic of having a very thick, smooth muscle in their breathing tubes, that is airways. So this procedure is basically a bronchoscopic procedure. In that there will be a certain catheter which is passed and try to heat that smooth muscle or this thing, and so to reduce the bronchoconstriction and reduce the asthma attacks and improve the quality of life. So this is the device which is available in the practice, where you have a console of a heat generating system, and you have a special catheter called Allied catheter. This catheter is attached to this console, and the procedure, the catheter is passed like this in the bronchoscope. That is, bronchoscope is put and then reached to peripheral airways. Through that, the catheter is placed, and the catheter will be placed in a different segments and different settings and sessions, and then the heat energy, radio frequency energy is passed to burn the wall of the breathing tube. And this is kind of a minimally invasive decade procedure, bronchoscopy procedure, but only in a certain selected cases of group of severe asthma, not in all the patients. So who are maybe not responding to the medicines, not responding to the inhalers, not responding to biologic injections also sometimes. So we are using, and in our India, almost 7 centers they have this kind of procedure service, and we are fortunate that we are thinking to have this service in here. and we will be shortly upgrading to this service and going to give a benefit to the certain severe category patients of asthma. So to conclude, asthma has moved from traditional approach treatment to a stepwise treatment to a precision medicine, that is a stratified medicine. It is no more all asthma is a one group and you give one inhaler and he will be improved. It is that you divide which group are you are belonging, which category, which pathway, which biologic pathway is happening in your body, and then you targeting that with the special injections and treatment therapy, either with available therapies and all. So to conclude, so definitely inhaler therapy is the state treatment which is steroid based, but if you add on fill into this inhaler therapy, the add-on therapies like biologic agents, monoclonal antibodies, and the special procedures, and you are going to give a wonderful benefit to the patient and improve the quality of life and make his life beautiful. So to that, I will be concluding the talk. Thank you very much. So.
This is like starvation in the midst of plenty. You have got so much of oxygen in the air, so much in the air, still you can't inhale it. It's like diabetes. You have so much of sugar in your body, but still you can't utilize it. So in an asthmatic patient, it is really, I feel pity for, because there is something, everything is available freely, still you cannot breathe it. And I am thankful to Prabhuji. Prabhuji is a different type of doctor. It's not like Hamare jaisa nahi hai. Systematic, stylish. He will do everything correctly as per the evidence based, and he has given results for that. So I expect that this severe asthma clinic will really help more people and more. And as what Dr. Karpatkar has said is very correct. That the pharmacoeconomics also is very important, because most of these patients are in the earning phase. Young people who are suffering. So if they are in the hospital, then who will earn for the family? So I think taking a correct treatment, I was talking to him also just now, half the patients don't get cured because they don't take proper treatment. Exact मतलब 8 milligram, 4 milligram here. On his own, he is trying to do most of the things. And then that wonder drugs like steroids, they will keep taking for lifelong without even coming to the doctors again. Now we should be thankful to the pharmacy and FDA, because they are not giving any drugs now without having prescription of the doctor. Otherwise, there were people who were taking, without going to the doctors, they were taking steroids for years together, and then they suffer from all the different complications. So I think it is important that you should follow what exactly doctor tells you. And the newer medicines, I know they are useful, but they are costly too. The cost is a big thing. I think I request the company that you have to bring down the cost to an affordable level. I know they have lot of other support system, but they have to come to a normal level when the common man is beneficial. Yes, over a period of time it always comes down. But when I started trastuzumab, I think it was costing around 1.5 lakhs. Today it has come to around 20,000 or so. So the cost always comes down over a period of time. So it is very important that some people like you have to tell people that yes, I feel okay. That's the most important part, that it helps in some people. And those people you have to identify correctly by the consultants. You can know that yes, this medicine will be useful to you. And Nathan has rightly said pediatric group is very important, because they are they cause a lot of psychological upset in the schools when they carry on with those cough, and they can't play together with their peers. Sends a very bad. First time I have realized that there is a psychological impact also because of this treatment, because carrying this in the hand in the school, it will send a wrong signal to the others. So people don't treat that to the school, and then they suffer. So I am really thankful for Prabhuji for initiating this. I hope more and more people will get benefit of it. Thank you.
Dr. Prashant, may we have you on stage? Dr. Mr. Chandrasekhar. Thank you, sir. I'd now like to